Good morning everyone. Today we are going to talk about chronic pancreatitis. So basically chronic pancreatitis is a disease of pancreas wherein we get a chronic inflammation and blockage of pancreatic duct, because of which the juice from pancreas is not drained properly. So this is what basic pancreas is. So why it is caused? It is caused basically because of either alcohol, it can be because of some family reasons, it can be sometimes because of any idiopathic reason where reason is not known properly. So having said these are the things which causes chronic pancreatitis, how does the patient of chronic pancreatitis present? Usually the patient of chronic pancreatitis present with either recurrent abdominal pain, sometimes it can present with diabetes, sometimes they can present even with jaundice, but that's very rare. Pain can be classically seen in this region, severe tightness followed by radiating to back on sometimes, and this pain is usually aggravated after food, and this pain can lead to sometimes vomiting sensation also. So how do we diagnose the chronic pancreatitis? So for diagnosis of chronic pancreatitis, imaging is very important. A simple imaging like ultrasound can tell us the status of pancreas. In most of the cases, not all, it can pick up the stone formation, it can pick up the diameter of the duct, it can pick up whether there is any dilatation of bile duct because of pancreatitis. If these things are not clear on sonography, then we can do a CT scan. And CT scan, we can see how is the pancreas, and these all things can also be in, and it is more confirmative. It can also help us in diagnosing the various problems related to chronic pancreatitis. So having said that, the diagnosis of chronic pancreatitis, now once it is confirmed by doing CT scan, ultrasound, or sometimes with MRI, what are the treatment options for chronic pancreatitis? Most of the time, chronic pancreatitis patient presents with either pain, pancreatic exocrine insufficiency, that means either oily stools, or with diabetes. So diabetes, we all know, it can be treated either with drugs or sometimes with insulin. Regarding pancreatic exocrine insufficiency, where patient present with oily motions, particularly when they take a lot of fat food, like they have food outside in the wedding, or where they have a lot of fat rich in food, they feel that there is oil in the motion. In those cases, there is a need to give pancreatic supplements. So these patients should take two good heavy meals, or whenever they are taking fatty food or a high protein food, they should take this supplement immediately after food, and then they can have a decrease in symptoms related to it. Then comes important pain. Most of the time, pain is managed when there is acute onset pain, it is managed with the painkillers. But we should keep in mind not to take high amount of painkillers. Then comes with painkiller, we should give always pancreatic supplement, because pain is most of the time aggravated because of the, so when patient eats, there is a stimulus for pancreas to secrete the juices, but this is blocked. So it causes more pain. In such cases, if you use supplement from above, these juices will not form and the pain episodes will come down. So in cases where pain is decreased with exocrine supplement, those can be managed. But if someone who is getting recurrent pain, they may require surgery. And surgery with chronic pancreatitis is most of the time rewarding. Pain frequency comes down. People usually have loss of their work, or they lose their school because of recurrent pain. In those cases, by doing surgery, they can be regular to their work and episodes of pain come down. There is also some people ask me a lot about ESWL, but most of the time ESWL doesn't help in pancreas, because if it is only single stone which is causing problem, in those cases if we do ESWL, it will drain and it will help in relief of pain. But if there are multiple stones and if there is blockage at multiple level, even doing ESWL will not help, and in those cases surgery is the only option. This surgery can be done either laparoscopically, robotically, or open way, depending on patient's preference or a surgeon's choice. Thank you.